Well, coming down with the stomach flu is never pleasant, and this year cases of norovirus, they are in fact on the rise. CDC data shows we've already seen double the number of cases this December compared to previous years. The highly contagious virus spreads through contaminated food. A person infected with norovirus can also pass it on by touching or contaminating a surface. Some of the symptoms you may experience are vomiting, diarrhea, stomach cramping, just to name a few. You may even have a little low-grade fever to accompany all those symptoms as well. Joining us now with more about the virus and how you can protect yourself is medical media personality Dr. Renee Matthews. Doctor, good morning to you. Thank you for being here. Let's start with the CDC numbers. 91 outbreaks through early December. We're coming off a lot of holiday gatherings. What do you believe is behind this spike?
Well, obviously we are all staying in more because it's cold, and norovirus actually thrives in cold weather. So that is another reason why. And unfortunately, I think we learned in the pandemic, people are just not as sanitary as we think they are. They don't wash their hands.
Wow. All right. I wasn't expecting that answer, but it's a good reminder. A lot of people associate norovirus with the flu. It's not the same. What are the major differences, and what should people be on the lookout for?
So it is, so the flu, of course, is very respiratory. This is really a GI problem. It's gastrointestinal. You're going to have stomach, you're going to have vomiting, diarrhea, and that's unfortunately another way of the widespread. Those, when you vomit, diarrhea, the aerosol particles float through the air, and that can also spread the virus. So just because you have a sick person with it and you don't have it, if you're not masking up, you're actually going to take in those particles, and you could possibly end up with norovirus as well.
Wow. So this does not have a vaccine. What is the best form of prevention?
Best thing is washing our hands when you're going to be dealing with food. Clean the surfaces off in your kitchen with bleach products. And if you are somebody who serves food or works around food, don't go to work if you're feeling sick, because you could spread that into the food when you're preparing it and then have a horrible norovirus outbreak at your job. Or, if you work in a cafeteria, you work in a hospital cafeteria, it's in small confined spaces usually. So dormitories, stuff like that. So please, if you're feeling sick and you're a worker around food, please don't go to work. Wash your hands. Make sure you wash your hands when you leave the bathroom. Wash your hands before you deal with food. And definitely don't forget those bleach wipes for your kitchen, all the surfaces in your kitchen.
So you may have given us some hints in your previous answers, but who is most susceptible to this virus?
So children, and of course, immunocompromised adults as usual. But anyone, unfortunately, this one has everyone pretty much, because everyone eats, right? And during this time, unfortunately, there's a lot of people eating, not necessarily just in their homes, they're eating at other people's houses. And so that's where we tend to see a spread.
All right. Wash those hands. Dr. Renee Matthews, thank you for joining us.
Thank you for having me.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.